Dear, thank you to Dr. Nunez Smith for taking the time from what I imagine is an extremely busy schedule to join us for the 2021 NC's conference. I think that there's a lot that our audience would love to hear from you about. So I'll start by asking, would you be able to describe your work advancing health equity before now, and then also give us a sense of your role in the federal task force?
Absolutely. And thank you so much for having me. I'm really excited to be here. So I am a researcher at Yale, and my research here centers on promoting health and healthcare equity for structurally marginalized population. You know, the work that we do encompasses a number of themes. So we focus on how best to support representation and inclusion in the healthcare workforce, the development of patient-reported measurements of healthcare quality, and identifying regional strategies to reduce the global burden of non-communicable diseases. So at the Equity Research and Innovation Center, or ERIC, which I direct, and it's a phenomenal team, colleagues and researchers there, our mission is around generating actionable research, thinking about how we best promote health equity and in our healthcare systems and in our population. So that's the work that we do. We always lead with our values around partnership, collaboration, and making sure that whatever we're working on is going to be translatable to policy and practice. So that I've been here for 16 years. So, you know, that's the work that we're doing there. You know, as far as the COVID-19 Health Equity Task Force federally, which I'm honored to chair, you know, we are working to address the health inequities that the pandemic has made really painfully visible for all of us. As a task force, we're charged with providing near-term recommendations to the administration, really about how to operationalize equity as a priority throughout the response. And so right now, for a lot of people, top of mind is the vaccine rollout, but you know, working on many other things as well. You know, PPE for essential workers, equitable access to testing and treatments, and the foundational need to build more data systems so that we can really be data-driven in our response to inequity.
So that's terrific. So how would you describe the priorities for advancing equity for the administration right now? What are the highest things on the list?
Yeah, definitely. So, you know, high on our list in the administration, very committed to ensuring equity along all the lines that I, you know, was just mentioning. So thinking about vaccination, testing, treatment, PPE, you know, top, we do need more accurate and comprehensive data. We want to be able to target resources to the communities that have been hardest hit. There is still so much that we don't know, quite frankly, about how the pandemic is affecting particular communities. You know, communities of color, rural populations, people with disabilities, individuals experiencing homelessness, and more. And on top of that, we need more place-based data. Really, when we think about how we operationalize care, we are really leading with measures and metrics of social vulnerability, but there's just a lot we have to do, including thinking about a better data system in partnership with healthcare systems.
Terrific. Yeah, go ahead.
Well, you know, I was just going to say the administration knows like the effects of the pandemic are not limited to health and healthcare. So, you know, poor health outcomes are one part of a wider web of inequities, as you well know. So thinking about the social, the economic, the environmental disparities, those disparities are ingrained across all of our systems. And so that's why in the COVID-19 response space, we have to think about healthcare, but also about providing economic relief to communities and businesses, expanding nutrition and food security, right, for millions of families, investing in emergency rental assistance. And so, you know, the president has spoken to all of these important drivers.
Right. So it sounds like there's a lot of things on the list, even once we start to move past COVID.
Yes, long list.
So, you know, this audience is many educators from the health professions and others. And we all see health professions education as a powerful tool to help address equity in healthcare and even more broadly. What recommendations do you have for educators in the health professions to help advance health equity?
Yeah, great. And, of course, I identify as same. Disparities in health persist, uh, whether we're talking about, access or quality or outcomes, and whether we're thinking about along the lines of race or ethnicity, gender, geography, sexual orientation, gender identity, right? So we have to address all of these realities in health professional education broadly. We I think can and need to move beyond sort of the siloed approach that we have sometimes taken in education, where we have our one workshop or our one session, right? We have to integrate and weave health and healthcare equity as a core component in the architecture of our training programs. So, an example. So if we are educating health professionals on the importance of collecting, let's say, high quality sociodemographic data in our EHR, we can begin to understand what is happening in healthcare settings and characterize, you know, bias potentially, right, where it exists. And so lifting up, underscoring the importance of using data in that way will allow us to advocate ultimately to improve quality of care. And so we need to identify inequities in treatment earlier and link disparities with high impact consequences moving forward. It's important, I'll add to, given that this is one of my areas of particular research interest, that we have to teach our trainees the importance of lifting up patient and community voice in the work that we do. Whether this is about the patient care experience, we study discrimination in care, but this is part of what we need moving forward, is just to be able to have frank conversation with our trainees about not just data, but also partnership and thinking of our patients and the communities that we serve as key partners in the work.
Yeah, that's a nice segue to my next question, which is really um, about the struggle that educational institutions and the country as a whole is having dealing with embedded racism in our society and in our educational institutions. Um, do you have advice for how organizations should facilitate dialogue that on racial justice specifically that could lead to real and lasting change in our educational institutions?
Yeah, it's a great question. And certainly, what I was just getting at is power, right? We have to have these conversations about power. In order to address embedded racial injustice in our educational institutions, we have to situate and understand the historical context as well as the current context, and really how all of this affects, for example, our health professional workforce pipeline. Specific racial ethnic groups are quite grossly underrepresented, whether we're looking at statistics in the physician workforce, 5% of the physician workforce identifying as African American compared to 13%. But, and we see that when you look at advancement, kind of representation declines along the career path. So, we have to kind of have that first conversation around who is even at the table when we're starting to try to have these conversations, and who quite frankly isn't. We have to think about, our professional associations, and that's part of the conversation. With some colleagues, we looked at, things like honors and awards and the receipt of those, and found that often, there is differential access to those. So that's part of our conversation as well. When we think about who is matriculating, for example, in medical school, who is joining the ranks of our faculty, right? I think we have to have a good conversation, quite honestly, about some of these structural realities, even as we begin to enter into the deep work of anti-racism.
Yeah, I think that I think that um, these discussions also lead to the content of the training for our once we are get the pipeline broader. Once we bring students into our academic environments, there's always the question of what skills do we try to impart, what content do we deliver. Do you have suggestions for what are the essential competencies or knowledge to advance health equity that really all health professions students should try to acquire during their training, and that we as educators should try to impart?
Yeah, yeah. Um, so, another great opportunity for reflection and thought. uh, I think, and it's core to the work that we do here at the research center. I think it's core to where we want to be as a health system here. It is essential for trainees coming through in terms of some of these competencies that everyone understands these social structural drivers. We cannot further health equity if we do not understand, just at the most fundamental level, the relationship between social economic factors and health outcomes, and be committed to addressing these issues. Um, as healthcare professionals, our obligation to our patients, doesn't begin or end at the door of the office. And so, kind of having different conversations about biology from social economic reality, I think we have to be better and teach our trainees that this is all part of how we think about approach to our patients. So, we have to consider social, political, economic processes, make it explicit that patients, doctors, and researchers, that we exist within particular contexts, that there is differential level of access, care, and opportunity, um, quite quite frankly. And so being able to teach our trainees about some of these spatial patterns, right, of poverty, access to nutritious food, environmental toxins, lack of transportation, right? That list. If we prioritize equity, we have to be ready to collaborate with community stakeholders and organizations to power share with them, as well as government and policymakers to address the issues at their roots. So there's certainly, there's been progress for sure, but as we have a conversation about competencies, I think we need to anchor there.
I really appreciate that, because our group is very focused on the social determinants of health. And I think that the firm appreciation that what the results, what people's health outcomes are, is a complex interplay between social needs, the environment, the economy, and it's not just this narrow biological lens. And I think that most of our audience is we're going to hear a lot of exciting talks about that during the course of our meeting. So, I think that these are challenging problems. What makes you optimistic looking forward for our country and for the world as a whole? What makes you think about realistic improvement for health equity in the United States?
Yeah, I definitely hold optimism and light in this space. We've had this collective witnessing and national reckoning in the past year around race and racism, and just the fact that so many are now thinking and talking and doing for and in the advancement of equity, I think is a source of optimism. There's been a lot of movement in the healthcare space, making visible inequities that some of us, but not all of us, have seen and experienced with a great degree of intimacy for a long time. We've also, I think, become acutely aware of just how enormous the task is ahead. But we're building very responsive, resilient systems with equity in mind. And so I think that is a source of optimism, that we will have systemic change that will help us address the root causes of health disparities. And like I'm always fond of saying, I am anxious for the day when I can work myself out of a job because we no longer need health equity researchers.
So I really, again, want to thank you so much for taking the time to share your thoughts with our meeting. And I wondered if there's any last thoughts that you'd like to share before we let you get back to the important work of the task force and everything else that you have on your plate.
Well, just thank you so much again for inviting me into conversation. And I would say that all of our work is incredibly important. And I want to thank everybody for your leadership, because this is really, when we talk about how one operationalizes equity, it's one person at a time, right? And it is building and being in relationship with our patients, with our trainees, our learners, and with one another. And so to all of you colleagues, I am grateful for all that you're doing. Thank you.
Well, thank you so much.
Have a great conference.